And you're alive.
Terrific. This is Senate Health and Welfare. We're back again. It is still April 2nd, and we are moving on to H80. And actually, the Office of Healthcare Advocate. We don't need, do we need Ledge Council up here? Oh, yes, we
Go over
do.
the amendment.
Yes, we do. Thank you.
Yes.
And I looked at it. You sent me or us a strike all, and then you were asking whether we wanted to put it in a strike all or.
Right.
Yeah.
Jen Harvey from the Office of Legislative Counsel. So we are looking at H80 and Act relating to the Office of the Healthcare Advocate. And I have brought you a potential amendment reflecting changes recommended by the stakeholders sort of in a consensus way that is reflected in here. I've done it as a strike all amendment so I can show you the changes in context as markup. But you can decide if you want to proceed with it and if you're not making other changes, whether you want to do it as instances of amendment instead. If there's several pages where nothing changes, that's all that is. So I'll put this up on the screen. So as I said, strike all amendment, but the changes don't occur until one in section 2. And this is in the certificate of need statutes. And the application process for a certificate of need, as you may remember when we did the walkthrough, the Office of the Healthcare Advocate and for nursing homes, the long-term care ombudsman's offices are authorized but not required to participate in review of an application for certificate of need and are considered an interested party once they file a notice of intervention with the board. In the bill as it came to you from the House, one of the provisions that was added for as new language would allow either the Office of the Healthcare Advocate or long-term care ombudsman's office, once they file a notice of intervention, to ask questions of employees of the Green Mountain Care Board related to the board's review of the CON application. This was language similar to what's in the hospital budget review statutes, but in this case, with those offices being interested parties, there was concern it wasn't appropriate for them to be as interested parties also asking questions of the board employee. So this language would be struck and the remaining provisions about submitting written questions and comments and asking questions and providing testimony would be retained, but just renumbered. So that's the first potential change here. And then in section 3, in the chapter on the Office of the Healthcare Advocate, there are a couple of changes that occur. They're in here. So the first one in the bill as it came to you from the House, it says that healthcare providers and health insurers must cooperate with the office by providing relevant records and information when an individual or their guardian or legal representative.
Is that?
We're on page 8.
Okay.
When an individual or their guardian or legal representative has authorized the office to act on the individual's behalf. And this would add language specifying that the healthcare provider or health insurer may require the written consent of the individual or their guardian or legal representative prior to providing the records or information to the office. This was particularly of concern to the Agency of Human Services as the Medicaid state agency, that they be allowed to require written consent, not just an authorization, but something in writing.
Okay.
That's what that language does. And then 9604, as it came to you from the House, says that in developing state policy affecting healthcare access and affordability, state agencies must seek input from the Office of the Healthcare Advocate. This would revise that to say that first make it intent. It is the intent of the General Assembly that state agencies shall seek input from the office, and then adds when developing or revising significant matters of state policy. So it's not every single thing they do, but when they're taking up something that is significant and affects healthcare access and affordability, in order to ensure that Vermonters' perspectives are heard and considered through the voice of their independent advocate. And that kind of calls back to language earlier in the chapter saying that they are an independent voice for Vermonters. And I believe that is it.
Yep.
So you can see we may not want to do a strike all amendment for anything, but can.
Which is, you can talk about.
Yep.
Questions of Jen? So these are things that it's your understanding that the group has gotten together and had some agreement about.
Yes, we had some conversations sent around language for people to look at, but you will hear, I think, from all of those or many of those who were part of that conversation. And they can tell you why they wanted the changes and if they have any concerns about what's here.
All right. Good, thank you. Is there anything else, committee, you want to ask Jen? We'll come back to, are you here for a while?
I am back and forth. I have to see what's happening.
Okay, because I can ask questions later about the other bill.
Definitely be back here around.
Okay, so we are going to move on to DFR and Emily Brown. Thank you for being here.
Thank you. Good morning. Emily Brown, the Deputy Commissioner of Insurance at the Department of Financial Regulation. I'm here to testify in support of H80. I haven't had a chance to review the suggested amendments that Legislative Council just ran through, but the bill is passed by House Healthcare. The department is in support. And just to mention, I think the changes generally reflect the practices and process that the department is currently undertaking with a healthcare advocate. We normally bring them into a conversation around legislative proposals, regulatory changes, anytime we have issues that are impacting Vermonters. We are in close communication with the healthcare advocate on all those issues. So I view this as just really updating the statutory language to reflect what is actually in process, at least from the department's perspective at this time. And I'm happy to take any questions.
As you were listening to the proposed amendments, did any red flags?
No, I have no immediate concerns. Great.
Thank you.
Thank you very much.
So we have Sarah Teachout, Blue Cross and Blue Shield. Thank you for being here.
Thank you. I'll be very quick.
Thank you.
Sarah Jones, Blue Cross and Blue Shield of Vermont. The one section of the bill on that we worked to find compromise with the Healthcare Advocate's Office was the piece around the questions during the rate review process. So currently, the Healthcare Advocate's Office submits their questions to the Green Mountain Care Board. The Green Mountain Care Board consolidates their questions with their own questions and sends us one set of questions. The only thing I want to elaborate on the process is it's a very compressed timeline. There's about 2-week turnaround to answer these questions as part of this larger rate review, and our concerns were that the questions relate to the rates being considered. And so that's, there's language in there that says they must have a substantial relationship to the rate review criteria and submission. So we are fine with that change.
Thank you.
Okay. And the changes that you heard in the proposed amendment, did that raise any red flags for you?
No, and I don't think they pertain to this section.
No, they don't. Just double checking.
Yes, thank you.
As my youngest daughter said when she was 4 years old, double check. Where did that come? All right. Laura, oh, you're right here. Good.
Thanks.
Hello, once again, I'm Laura Bellovo, a staff attorney at the Green Mountain Care Board. So I submitted a letter already to express support for H80. Wanted to just acknowledge that the Office of the Healthcare Advocate plays a critical role in the board's work in certificate in the CON and rate review matters. I work on the HCA's involvement as a party to the proceedings brings valuable insight into the impact of the board's decision on Vermonters, particularly issues of affordability and access. We support the change to strength in 4062C3A and D to strengthen and streamline the HCA's ability to ask questions of the carrier and rate reviews proceedings. It also clarifies the board's obligation to post the full record redacted for confidential information on the website, which is the board's current practice. Section 2 amends 18 VSA section 9440 C9B and C to give the HCA the right to receive copies of all CON materials in the dockets in which it is intervened, and to allow the HCA to submit written questions and comments and to ask questions and provide testimony in CON hearings. The most significant aspect of this section is to streamline and clarify HCA access to confidential material and its obligation not to disclose that information. I want to also express agreement with the proposed change to the language in the CON proceedings, that the CON not be, that the HCA not be allowed to ask GMCB staff questions in a contested proceeding. And in the section 3, there was the proposed change also drafted, which adjusts the language regarding the HCA's input on matters affecting healthcare access and affordability, and the board supports that change. And so that was that concludes my testimony. I'm happy to take questions.
Sounds good. Committee questions for Freeman Care Board on the bill. So overall, you're supportive of the bill and you support the proposed amendment
Yes.
that we just went through.
Very much, yes. Thank you.
Okay, that's good. I think rather than muddy the waters with H96 right now, perhaps we'll come back to that.
Perfect. Great. I'm here.
Thank you. And last but not least, we have my picture, the healthcare advocate. This is all about your office, so.
Just one year.
Did AHS want to testify on this?
We're happy to just be here. We approve and support the amendments that were presented. If you need more from us, we're available.
Okay, thank you.
It's a big moment.
I know, it's just, we're treading lightly on the.
I can't remember this.
Mike Fisher, healthcare advocate. It took a little work to get to the Kumbaya moment, but the work was accomplished and we're here. So I guess, would take a little direction from the chair if you would like to stick very strictly to, the amendment that's in front of you, or if you would like me to talk a little bit about our work and how I see it going forward.
Your which?
Our work and our role in this.
No, I think sticking with the proposed amendment, and then we'll have questions and maybe get to the broader.
Yeah. So we are supportive of all of the amendments that Jen brought forward, and of course,
Wow. Nice.
Okay, that's it. Senator Grulich, don't you dare bring up something.
No, it'll be fine. But thank you, Madam Chair. My experience with the healthcare advocate and the office of the healthcare advocate are relatively, short. I haven't been here that long. And you are the person that I associate with this position.
Yeah.
When I think about, I know some of this work, a lot of it you're already doing. This is codifying it. I guess I want to feel good about the fact that someday there will be a different person sitting here and there will be different folks in the office. And with that in mind, you still feel, knowing that that's an uncertainty, that this is all
that's a great question.
very needed and
That's a great question. We have a great working relationship with various parts of state government today. And so, very much so, this bill is getting into statute, sort of the background of that work. When we need to work with DEVA about communications with Vermonters about something, we have a great working relationship with, with DFR, I'll just, med sup rates or something like that. And I want to recognize that, not the DIVA example, but the DFR example, we've been doing it, DFR's been doing it, it's been outside of our mandate. It's been maybe referenced in a way in our mandate, but I often felt like our mandate previously was much more about insured, so there were examples that came up like, we did a decent amount of advocacy around access to healthcare for people in our correctional facilities. And I had to really dig and sort of, like, how does our mandate, I wanted to read our mandate as clearly as we're there to support improving Vermonters' access to care. I don't care where you are and who you get insurance, coverage from. You're here, you're a resident of the state, we're a resource for you. And I think your point is important. I'm only here for so long. We all get a little turn in these seats, and structure is important. So I think it advances.
When was the last time that this section of statute was up?
I think it was 2013.
Yeah, that's what I was thinking. So it's time to reevaluate the work that you're doing. We have a different model now. I mean, in 2013, there's a prediction of one kind of model, and now it's just different.
And I sat in a different seat in this process in 2013. We thought we were going in some different directions.
Exactly.
And I'll just say, at that time when we were thinking about really having the state do, people talk about, taxpayer financed healthcare or single payer or whatnot. What we were really talking about was the state being the insurer and the state having to make decisions that we currently have, that currently happen by the carriers. And the discussion about the healthcare advocate's role really was, hey, Vermonters are going to need to have a strong advocate against the state if we move in that direction. And of course, things didn't go exactly according to plan. And our role and we went through the whole mess of launch of Vermont Health Connect and all of its challenges, and the healthcare advocate's office. His role changed significantly, increased during that. There was increased need. And then I'm sorry, Senator, just one more quick comment. I think it's important to me that I have a moment to say it. I often get asked the question when lawmakers are considering, I want to make an advocate to do child advocate or something else. People say, hey, do you think the advocate should live inside state government or outside state government? And my answer is always, it depends on what you're trying to accomplish. There's a trade-off. Inside state government gives you access and to data and a better influence, theoretically, to influence state government. Outside state government gives you more independence and more of a watchdog role, and challenges about access to the information. And so, like I say, we've got a great working relationship with state government, but that tension is there for us too. Where should we be at the table? Where is it appropriate for us not to be at the table? So,
Well, but
trying to strike
thank you for your work, because you've done a great deal to make it a collaborative process, and it can't happen otherwise. Otherwise, citizens of Vermont don't get the support that they need. Appreciate it.
Senator, I will also just say the thank you committee, previous committee, for your support for the HCA budget requests in previous years. This year we are level funded and we are good with that. So we have no funding requests. But there are other parts of the system that we are very concerned about. And I'll just mention one of them now.
You got a half a second.
I'll just mention one of them right now, and that is we are a very key partner for us in providing care to a very vulnerable population, as Bridges now. And we've been advocating for them on the House side unsuccessfully, and And
So we did hear from Bridges early in the session, and I think there was, that resonated with us. Thank you. Thank you. Thank you. So this looks like a bill with lots of problems. I don't know how we're gonna handle it. I think when Jess comes back in, we'll put it on the agenda for markup and vote, ASAP. Doesn't feel like we need to spend huge time. And similarly with H96, I do have a couple questions for, Green Mountain Care Board. Maybe you could come up if you don't mind, and we'll try to go through that a little bit. The only big question we have to answer about H80 is, do we do a strike all or do we do a separate proposal amendment? And we'll deal with that with our ledger council. So that's good. So thanks for coming back. And as we were going through the bill, and I'm gonna have to reach out. I know that Mike Fisher a healthcare advocate brought up the question about considering some conditions when the CON was approved. And one is, like, for example, requiring Medicaid, accepting Medicaid patients. What were the other conditions, Mike? I'll let you.
requiring the board to consider whether the entity should accept Medicaid and whether it's appropriate to have a recommendation based.
Okay, that one.
And-
And we put you on the spot here. This is not probably, this may not be a question you can answer automatically, so.
Thank you for that. Yes, that's Laura Bellavo, staff attorney for the Green Mountain Care Board. I cannot answer, and I know the other issue that was raised in your slides that I saw ahead of time was the question of, would you leave a CON? Certain CON conditions should not expire with the CON. They should be ongoing. I don't know the board's position on that.
Okay.
In terms of putting it in statute, I certainly can say that the board has pretty consistently worked to have providers accept all payers, including Medicaid, has in at least one case implemented a sort of reference-based pricing condition. I can see where it might be helpful to have that in statute, but I don't.
So, yeah.
But having it maybe be required or something, I'm not sure what they think about that. And then the same thing with the CON conditions. They do expire when the CON expires, which is typically at the end of when the project is fully built and up. We've often extended conditions for a period of time beyond that, but not indefinitely. And so I'm happy to get a position and send it in. I don't.
That would be good. I mean, if you could just have that conversation, so that, I guess the question is, shall consider, may consider, should consider. So the around that and how it currently happens and whether or not the board feels it should whether it should be in statute. So that's the question with that one.
Great.
And the other issue that came up relevant to you is having the bill take effect on passage rather than July 1st, and what, if any, administrative, things have to happen from your perspective.
I think that would be, we don't have an objection to that. I think administratively, we'll get a flurry of requests to withdraw and then resubmit. And at first, when I was thinking about it, I got a little nervous about our ability to have so many applications on now the exact same time frame, but they all have already been submitted and we have done some work on them. So having our time thresholds should not be a problem.
Okay.
So I thinking it through this morning, it is not a problem, and I'm comfortable saying that it could be implemented upon
Thank you.
passage here.
Okay, that helps. Was there anything else I'm forgetting on this one? Is there
Well,
another?
there was the sale, but
Oh, the sale issue, but
Yeah.
I don't think that,
Yeah.
yeah. Okay, that's good. Thank you. And
Thank you very much.
that'd be great, just to get your thoughts on that. May shall should consider piece. That'd be great.
Okay, thank you.
I do have another suggestion, but you can. My other suggestion is, that we should think about, the committee will have to think about, is, and you folks who are involved in this, this is on 96. The concern about state projects, now perhaps it is a notification that the board receives whenever state projects are going forward, so that at least the board knows there's something there. So I'm looking at AHS for that one.
I think the board is privy to all of the other places where it's posted, but if we're simply talking about sending the board a letter when we. are doing
Yes,
state
that's
project,
all I'm
I don't
talking-
think that's burdensome to us.
Okay, well, I'm talking about that because there have been concerns about, what effect will this have somewhere in a community in terms of patient access, and cost. So, all right, so we'll think about that one and just the board, healthcare advocate and AHS are all here, so. Yeah. Your thoughts on that would be helpful. Okay. Terrific. So Jen,
Yes,
you're back.
I'm back.
Let's do this. Can we go to H80 and then we'll go back to H96? And I think the committee has some things. Sure.
good morning.
Good morning. Welcome back. So I think that we've heard that a lot of agreement on H80. And I'm not, unless I hear differently from the committee, I don't think there are additional amendment recommendations. And what I think we'd like to do is to put an amendment in front of us. And I'm looking at you for what works the best in terms of strike all versus instances thereof.
I mean, it's strike all certainly easier for
Yeah.
you all to read.
Yeah.
But if and I can
And we already
save my markup version to show to the House if to show them the changes, if that's what you send back over there.
I think let's do the strike all for
Okay.
simplicity's sake.
Just gonna taking out the highlight.
And then,
So you feel like you're ready to go with?
yes,
Our regular city council, which is good. You're ready to go with H80 with that amendment and just
Yeah.
a clean version of what
yes.
is already fine.
Can we go through it one more time so we have some clarity about what's there?
The whole bill or the amendment or?
Just going through the bill and putting the amendments in context with the bill. So, yeah, I mean, that's.
All right, so this is the amendment that will be what you have without the highlighting. So I'm unclear, do you want me to just go to the highlighted pieces again or?
Well, just
remind
tell
you of
us
everything
the
generally that's in here?
50,000 foot
Okay.
level.
Yep. So section 1 is some amendments to the health insurance rate review section and expanding the authority of the Office of Healthcare Advocate to be able to actually have the questions asked. And having all of the information, the whole rate filing made available to the public. Section 2 is the certificate of need process and giving the intervening party or the interested party, whether Office of the Healthcare Advocate or Long-Term Care Ombudsman, the right to receive all copies of all materials, not just or discretion about what's necessary, and taking out the language about asking questions of the employees, but having questions for the board to ask and submitting written comments. And asking questions and then clarifying the confidentiality. Section 3 is the Office of the Healthcare Advocate, and a lot of changes in here to kind of reflect the expanded scope of the work that the office does as compared to what was perhaps envisioned when it was first codified. So not just health insurance and access to health insurance and healthcare consumers, but really more about access to healthcare more generally, allowing more than one director. It's just expanding the role a bit and in keeping with what I understand to be current practice as far as where the office is representing the voice of Vermonters. And then we have language added to the provision that requires, which really just moved from elsewhere in existing law, about healthcare providers and insurers cooperating with the office by providing records when they have when they've been authorized by the patient or individual or their representative, but allowing the provider or insurer to require written consent.
Thank you, Madam Chair. Just for clarity and surety, on page 6, I know we had sort of questioned the word ensure versus facilitate. Did we decide to stick with ensure? It was line 9 on page 6.
You're right.
I mean, it's ensuring policymakers hear directly from Vermonters by facilitating public comment.
Yeah.
Got it.
So I think that still works. I'll look at the office, but I don't think it requires them to. What it's really requiring is still the facilitation of public comment.
Right.
Good catch.
Yeah. And then in 9604, revising that language around state agencies seeking input from the Office of the Healthcare Advocate to make it clear is when they're making significant changes on significant matters of state policy, not everything about state policy. And then the language in the bill as it came over to you, allowing the office to access confidential and proprietary information as long as it's not prohibited from disclosure by state or federal law, or would cause the provider to violate statutory or common law privilege, but ensuring the office does not further disclose any confidential or proprietary information, and also specifying confidentiality or revising the language around confidentiality for information related to the individuals using its services. So the prior confidentiality piece was really about state agencies providing information to the office and the office not disclosing that. 9605 is about the office maintaining the confidentiality of information from the individuals it's working with. And then there's that language around conflicts of interest, and allowing or saying that it's not a conflict of interest per se, for someone to serve without compensation on a board that is not primarily of directors of a nonprofit entity whose primary regulator is not the state. And the act will take effect on July 1st.
Okay.
Anything else?
So I think we have it. This is it. So my suggestion is that tomorrow Kiki will find a little spot for us. You're not here tomorrow, are you?
No, but I can't. I mean, I'm not currently, but between 10 and 12, I was just going to be listening to testimony upstairs, so I can make in that window.
Okay, well, Kiki will put you in there. We'll have a markup and vote
Yeah,
on the schedule for H80.
Thanks.
Okay. Good.
Great.
Right, so let's go to
Maybe you want to go look at the
96.
Pull that up and sort it out. Okay, H96. It's increasing monetary thresholds for certificates of need. I think you've heard from some folks today, a little more than I have. And I know one of the suggestions from the Green Mountain Care Board that I share, and I think we've talked about it here, is the idea of somehow combining
Yes.
the non-hospital healthcare facilities and hospital healthcare facilities now that the monetary thresholds are the same. So that will require a little bit of work just to reconcile to the extent there's any differences between them, making sure that
Would we be able to look at that by Friday? Okay, let's do that. And then we'll hear back from the board. And
and I know the board had a few other
yes,
other thoughts on
Yes.
clarifying in there. Are you comfortable with those suggestions? I guess I think they
hear
are,
the
but
outcry from the table or the.
Right. Pull them up. So yeah, so clarifying the ambulatory surgical center thresholds. And I think that question of thinking, channel by looking at Laura's testimony, is the $10 million threshold apply to all projects?
Yes,
Or subject to the same thresholds as other healthcare facilities. I think again, if we're sort of combining everything, it may make sense in the current review, but just to put ambulatory surgical centers in with everybody else and not have their own standalone.
Yes, I heard that they did not object to that.
yeah, I mean, that makes a lot of sense. Greater efficiency. There was a comment on number 6 on page 2.
Yes, that's exactly what that is.
Oh, yeah, okay, that's it.
Others, okay. Great, separate categories, I think makes sense. And then I'm not sure where the committee is on the exemption for state funded projects, or if the chair mentioned notification, but maybe not exemption, so I just want clarity on what
I
you're
mean,
thinking.
I think, let's ask the committee. I'm fine with leaving the exemption in. I would think a
So
letter.
there
to-
is no exemption in the bill if it came over to you from.
I understand.
Okay, so you said leave it in, but there is not one, so you mean add an exemption? Okay,
Yeah,
that's fine.
but I do think a letter of notice to the Green Mountain Care Board.
I see, so create an exemption, but require the state to notify the board.
Right, and I have no idea what will happen when the board doesn't like it, but doesn't like what comes in. But at least it will give public notice and the healthcare advocate can spring into action.
Referee.
Okay. All right, so add a new exemption for the state projects. I think similar to what was upstairs, and I think the agency had some updated language that I had, so, okay, and then, but add a notification.
Yeah.
Okay. Are there more? There's something else from CHS? No, that was it. Is there anything else from any?
I have some stars. That effective on passage was something that came through with a number of votes. So, and the board has just said,
So it's not effective on passage,
Yeah.
effective on July 1st, and then has the, keep going with ones that are having interested party status don't
right.
allow withdrawal. Is that?
So the board has said they're okay with having it effective on passage.
Yeah.
Okay, we've heard that. Were you in the room when they said that?
I'm not
Okay.
sure that I was
They just said it. You were somewhere in your,
maybe I was.
okay.
catching up.
That was one. The other one, there was a lot of agreement on this section 1, number 6.
Okay, so then everything that's about the before and after July 1st, 2025 date would just be date of passage.
Yeah. That's it. I think I didn't hear anything. That's right. I said something else.
Yeah. Could we maybe as a committee discuss page 1, subsection 3, the 50%, more than 50% ownership piece?
We probably should take more testimony to that. This is underlying.
Right, this is existing statute.
Existing statute.
You think the testimony that was just heard upstairs on birth centers, board, was that they supported an exemption from the subchapter for birth centers. there had been some conversation about carving out birth centers just from the transfer of ownership piece, and I think that sounds like there may be more issues involved and perhaps a future look at transfer of ownership more generally. Was their recommendation in this way this time? Is that accurate?
Yes.
And feel free to hear from director.
So, yeah, so do you want to have,
But if your concern is specific, is sort of mostly around the birth centers, I don't know
It is.
exactly. Okay,
Yeah,
I
it
should
is.
know later. We're
Yeah.
doing markup later today.
Yeah.
I,
And on that bill.
yeah, so that would be great if you could let us know.
Yeah.
I know folks are concerned about bad actors. I completely understand. I also feel as though, you know, the arguments to not have this is that number one, we know that birth centers are not big money makers, they're not big revenue generators. And, you know, if a midwife opens a birth center, right, she or he would ultimately be responsible for selling when they're done with their, you know, tenure of potentially selling their entity. They're gonna have a choice of, you know, who to sell it to if that's what they're doing. So, I mean, I think we also have to rely on the ability of the person who owns the entity to make a good decision when it comes to a sale of it. So, and just to be overly concerned about a bad actor, again, I think is, don't let the perfect be the enemy of the good. I want to make sure that we're protecting birth centers as we do this work moving forward.
So I think we'll have a better sense by this afternoon of where they are, you know, obviously hearing from the certificate of need issuing entity that they're comfortable with an exemption may.
But I mean, would that go in here or is that in the other?
It would stay in the birth center, just, I mean, it doesn't really matter which one it's in. As long as both get, but I think we're talking about just changing where in that bill it would go. Right now, it's kind of tacked on to an existing exemption for offices of healthcare practitioners. And the Green Mountain Care Board, Laura suggested, and I agree that it really is better as a standalone exemption in the exemption list, just so that it's not, so that's clearer what it looks like, but it would still exempt them from the whole subchapter. So
Okay, so it's not just an exemption for a certificate of need, it's a
it
certificate
is, but it's from the whole subchapter.
and the sale,
But that's what a certificate of need is required for.
right?
Yeah, so it's not just
Okay.
to establish one.
Clarity.
It's from the whole subchapter on certificate of need, whether expansion, purchase of equipment, transfer of ownership, the whole subchapter.
Okay, great, thank you.
Yeah.
I still have concerns about hedge funds
yeah,
and their buying up.
yeah.
That was,
Nursing
and that is the
homes.
conversation that was just
That is
yeah,
the
yeah,
issue.
upstairs, but I
in
think that is a
number 3 right there.
potentially a separate.
And we've seen it, and we're seeing it happen left and right across the country.
And then
And
The
then,
transfer of ownership is already excluded from the CON for nursing home is already excluded from the CON process because they go
Also
through the
buying-
Agency of Human Services. So if you wanted to hear about it, you can certainly hear about it when the Agency of Human Services.
They're also buying childcare centers, and schools, and I mean, the whole country is moving toward privatization of all kinds of things, and we still need to move.
so let's do that. Well,
They're
Let,
not publicly owned. But you have huge conglomerates who are buying them up, not for the purpose of providing a service, which is what we want, but for the purpose of making a profit. And in most cases, large profits. And I think we have to do what we can to make sure that we stay what we established them.
I also think to Senator Cummings' point, there are different kinds of birth centers, and I know Florida has birth centers that do C-sections and do surgeries and much more. They're not what we're talking about here in this state.
right, so I'm gonna suggest that this is a good conversation. And that we see what the House does with the bill that we've sent over. opening up 3 on page 1 of H96 is a huge conversation that I think we all understand, different from what is in that bill. So let's just see where it gets us.
Yes, and there was a recommendation this morning from the Office of Professional Regulation on S18 to add a definition of low risk, which is what the types of births that are allowed to be done at a birth center. And they had some suggestions, including saying it's not a necessary section.
So we understand.
That may be, I have not
It's an
gotten
issue.
direction yet, but that may be part of what comes back.
And it is an issue in the committee. We all, I think we all feel that.
And the House has begun exploring the issue of, private equity and other interests in it.
They said they would.
Yeah, and they did, and they've taken some testimony. There's a bill, the Office of the Healthcare Advocates has been very involved in putting forward that issue. So yes, there will be continuing conversations on that issue.
Okay, so what we'll do is we've looked at some recommendations here in the bill. Jen, you can bring us back something for markup and possible vote for Friday, and we'll then have a better sense of the direction that the House Healthcare Committee is doing on birth centers. We don't have to go for it right away. We can just hold our horses and see what's what.
So it sounds like what I'm bringing back to you in section 1, I will be combining subsections A and B. And as part of that, sort of folding in number A6, subdivision A6, which has to do with the ambulatory surgical center and folding that in with everything else, and then adding a new exemption for state projects with a notification to the Green Mountain Care Board and changing the effective date to on passage with the pieces that go.
Can we also notify the healthcare advocate? Do you want that?
I actually think that, Mike Fisher, I think that the agency's testimony earlier is accurate, that the HCA bill
Covers the basis.
is going to require them to communicate about things like that
We got
before, even before they communicate to.
We don't need to be the Department of Redundancy yet again. Okay,
Redundancy department.
okay. All right, and then on passage.
And then on passage with all of the related pieces on passage.
Okay, so that's those two. We're making great progress.
And I may want to work with the board on combining.
Please.
Yeah.
All right, so we're going to take a break until 11.